trochanter major. Okay, so more or less, if we imagine this should be like this. So what we are going to do is to place our fingers in this direction, which is the expected direction for the surcus, and sometimes we can feel a bit of surcus, okay? So I'm going to palpate. This is very high, but for example here, here it seems a bit of surcus, okay? So I'm going to check here. Yeah, here I can find some surcus. So more or less, I think this is what we were expecting, no? Okay? So this was the line that we took as a reference for gluteus medius, and we say, okay, don't go, never go over this line, because here, especially in this midline, we have a lot of risk to go through the sciatic nerve, okay? So now, what we are going to do is to consider that trigger points are going to be mainly in this mid part, okay? So we are going to needle more or less in this direction, okay? So if we palpate indirectly the possible thought bands, we can be doing more or less in this direction, okay? No, bueno, se moverá igual.
Yeah, this one.
This is the surcus, so all this, perhaps. What about this?
Yeah.
I feel this is not a direct palpation, but well, you feel something stiffer there. Better. Well, surcus. I think we can try here. No?
Points.
What do you think?
Feel it full of trigger points. Yeah.
Okay.
Whenever you put your hand, it's still.
Okay, we are going to do just here, okay? Which needle we are going to use? What do you think? Yeah, 50. Usually gluteus maximus is very thick, so we will need, I think, 50, but if we have a big patient, we can even use 60 or 75, okay? But for this patient, I think 50 may be good, okay?
Depending on the size, huh?
So my main concern here is going to be that the patient doesn't refer any electrical feeling. With something that happens, I don't know if you experience now all these months, is that when you tell the patient that there is some risk, and if you feel any electricity, sometimes even if you have a twitch that sometimes reproduces like an electrical activity, the patient is like very afraid and say, no, electricity. So sometimes the question for you is to say, well, if I'm just inserting and I'm feeling a twitch, perhaps this can be a bit electrical, but I can confirm that this is a trigger point, okay? So sometimes here it may be a bit difficult for some patients.
Maybe if the electrical feeling was referred down, so it may be more towards sciatic, right?
Yeah, the problem sometimes is that piriformis, well, sometimes it's giving pain here, but sometimes it can be also referring a bit of pain. So when the patient has referred pain, he's going to think this is a nerve, because this is the thinking of the patient. So sometimes he's going to say, no, I have had referred pain, but they always refer like nerve. So depending on the distribution, for example, sometimes if they say it reaches to the toes or something like this is not so common, but if this just refers a bit. So, but the main point is that if you are clearly feeling a twitch or not. If you don't feel clearly a twitch, you say, well, I have to change, okay? So we are going to look for here I have the surcus, so I got a bit lower. What about this area? I think it's a bit harder. It's impossible to differentiate anything, but I feel a bit harder, so I'm going to do it here. 1, 2, 3. So more or less I'm going to keep this orientation. So I feel some resistance.
Yeah.
Twitch. less resistance. Now a bit more resistance there. But here, for example,
Feel it.
yeah,
I feel it.
there is a bony feeling at the end, okay? So with 5 centimeters I have reached everything. So this is fine, no electricity?
No electricity.
Okay, so I'm going to do here,
Oh,
here.
yeah, got it. Interesting, my leg.
So I haven't changed anything the direction.
I felt it.
زي ما-
Take my palm of the.
زي ما يحمس شوي.
Okay, so I'm going to
لا
change
لا
a bit.
بس يعني لأنه قاعد تشد. Okay.
Have you realized that I haven't changed the direction and it was giving
So in this
electricity?
case-
So
I will change the direction. I will adjust
now I'm
the
going,
switch.
yeah, I'm going to change it. But this is strange because if I have gone through, there is no electricity and I repeat the direction, it's a bit strange sometimes. They are because of trigger points, but he's a physio, so he knows. What
So
about
in
this?
that case,
No,
when I inserted for the first insertion and
But
there's
that
no
one was
electrical
obvious.
feeling,
Hmm.
that means
The
that
pain
my
was
sciatic nerve is
radiating.
not on my way.
Then-
Yeah.
I start to move even without direction. This is a
Is-
referral,
Yeah,
not the sciatic.
yeah, I may assume that, but if he's a physio and he's telling me it's electrical, I have to believe it. But if he was a patient, I would be saying, okay, if I'm feeling twitches while moving and while doing it very slow, I haven't feel any electricity, well, I shouldn't think this is the nerve.
Oh,
But
okay.
as he is saying me, well, I'm going to trust. But if you have any doubt, you just change a bit. Okay, so for example here, what do you think?
No.
So this is apparently free.
Okay.
So I'm going to do this. Do you feel anything?
No.
Okay. I'm going to do it a bit more lower. Let me know.
Yeah.
No electricity?
No. No.
Here is a bit
I felt
stiffer.
the twitch.
Here.
Yes.
Do you feel twitches?
Yeah. Yeah. Ooh.
Okay, here there are a lot of twitches, okay? So what I usually do is that wherever I change a bit the direction, the first entry I say, okay, it's fine, so I repeat. Then I go changing, okay?